I'm Jennifer Demuth, Director of Health Promotion and Community Relations with the Tuscarawas County Health Department, and we're here today to talk a little bit about our goals for wellness. You know, as we enter into 2022 and, start this new year, we want to think about our whole health and what we can do to be the healthiest we can be, not only for ourselves, but for the people we love, including our family members, our friends, and even our relationships. And I'm so happy to have our guests with us today. And with me are Allie Miller, our certified nurse practitioner who specializes in family medicine from the Tuscarawas County Health Department. Hi, Allie.
Hi.
Thank you for being here.
Absolutely.
And we're also very fortunate to have with us Amy Kaser. She's a registered nurse and our Director of Nursing at the Tuscarawas County Health Department. Hi, Amy. Good to have you.
Thank you.
Thank you. All right, ladies. Well, we're talking about, wellness. And in particular, there's a program we have at the Tuscarawas County Health Department known as our Reproductive Health and Wellness Program. And I know oftentimes that term reproductive can be a misnomer. It doesn't really cover all that we do, with reproductive health. So, Amy, what can you tell me about some of the services that we offer to men and women and even adolescents through the Reproductive Health and Wellness Program?
Yeah. So first of all, a little bit of history. Tuscarawas County Health Department has had a grant through the Ohio Department of Health through the Title X funding to help provide services to individuals, not only in Tuscarawas County, but even outside of Tuscarawas County with reproductive health. The grant funds us to be able to provide services that maybe they wouldn't be able to get elsewhere because of their insurance information or just their age, things like that. So thankfully, we've been able to have that grant for quite a few years, and we've been known in the area as the place to go for reproductive health services.
Okay. I'm going to pause right there, because we're talking about how people can pay for services.
Yeah.
So my understanding is then those who maybe don't have insurance or have insurance that's maybe inadequate, maybe they have a super high deductible, they could come to the Tuscarawas County Health Department and get services either at no charge or for a discount.
Yeah. So we have a different layer of to the onion with that, I should say. If individuals have insurance, of course, we can bill your insurance for that.
Okay.
If individuals do not have insurance, because of the grant, we do take donation, those kinds of things. However, we also have on staff, we have a contracted navigator who assists residents of the county or outside of the county with looking at the marketplace, seeing what they are eligible for. They may be eligible for Medicaid or some insurance that they're not aware of.
Okay.
That could help pay for services as well. We also have the ability to offer a sliding fee scale for individuals as well. So we don't turn anybody away from this particular program because of their inability to pay.
That's really nice to know. So if you have insurance or if you don't despair. Call us at the Tuscarawas County Health Department. That is so good to know.
Yep.
And then what are again, some of those services? Yeah.
So again, we look at reproductive health as a whole, and Allie will go into that a little bit more, I'm sure. But it's more than just a woman coming for their annual exam and their PAP, that kind of thing. We also want to look at individuals who might be wanting to become pregnant, and are they healthy enough to become pregnant? What do they need to do to get healthy to become pregnant? If individuals are coming in, we could do pregnancy tests. We can do, if they decide they want birth control, we have various options that, Allie can go through as well. And we help the individuals make those decisions. And just looking at their overall health, as for men and for women, making sure that they're the healthiest they can be, if they want to have children or not. And if they don't want to have children and they're not childbearing years anymore, how can we help you with menopausal symptoms, things like that. So, we look at it from one end of the spectrum to the other.
Right. So you really, as people are out there and they're thinking about their New Year goals and wanting to have total health and wellness, starting with an appointment for reproductive health and wellness sounds like a good starting point.
Absolutely.
Yeah.
Absolutely. I think it's something we all put on the back burner and say, I think I'll get to it eventually. And before you know it, 3 years have passed, and, it's something that you really need to keep an eye on, because there's certain things, if you catch early enough, it's a lot more treatable or even curable versus waiting too long. And then you're in this rut of having to keep treatment up or, have other appointments that you didn't really need to have because, you didn't do something preventative.
And so you kind of touched on this, how we run the whole gamut from, someone maybe looking to have birth control to someone who maybe has menopausal symptoms. But what would you say is the typical age range, for the patients?
We see all age ranges, really. I mean, we see as young as, 14,
Young
13,
as 14, all the way up through, I mean, I've seen women into their late 70s come in for reproductive health, and I think that's awesome. You know, there's a lot of preventative things that we still do that I think is important, that they come in for those appointments.
Okay. Even for the men, too, you know, having issues with men and, you know, those kinds of things. You know, our reproductive health doesn't go away just because we're not in that typical what we think childbirth is, like 20 to 35, whatever that is, you know. I mean, we have to pay attention to our reproductive health throughout our lifetime.
Absolutely.
And with maybe some of the older patients, do you provide referrals for, say, you know, mammography and things of that nature?
We make sure that they're plugged into the right specialist, whether or not they need referred, we take care of that.
Okay. Yep. Yeah. And refer to mammograms.
Absolutely.
All right. And I have to cover this because it's a little known fun fact. Men can get breast cancer too, isn't that right?
Correct.
Yes.
Yeah. Okay. So, you know, even a man, you know, maybe he's concerned, you know, he's found something, you know, on his chest that doesn't feel like it should be there, you know, make an appointment, come see us. Would that be true?
Yeah, absolutely. Yeah. Absolutely.
Okay. Very
Again,
good.
this isn't just a woman's issue. I think a lot of people think reproductive health is just a woman's issue, and it's not. I mean, it's a man and a woman's issue. So I think the men need to take just as much responsibility for their reproductive health as women feel they need to.
I agree.
Okay, very good. And so I really feel like I have a good understanding, you know, from you, Amy, as to who can come and what types of services we offer. And you had touched on a little bit about, you know, what are some of the things you look for, and that Allie could maybe go into some detail with that. So what are the things you're looking for? Say the typical adolescent patient who comes in, and I know oftentimes teens especially can be really nervous about that first appointment.
I think I think it's everyone that comes in for that appointment.
Yeah.
But when I have a new patient come in, especially a younger female or even a male, they come in too, I like to sit down with them and talk before I even have them change for their exam, because I think it's important to build that rapport. But then a lot of times I spend the first part just educating, you know, breast exams, self-exams, things that are important, vaccinations. And then usually at that point they feel comfortable enough that we can go ahead with the exam. But most of the time I just think getting the patient to feel comfortable and understanding that everyone has to do this. This is important for your health. You know, this is part of being a woman or a man, you know, and that usually helps ease their nerves a bit.
You know, sometimes people think that just teens that are engaged in relationships need to have reproductive health, but there are also those teens who might be having really uncomfortable periods, who might need to come and get help for that. You know, could you speak to that a little bit and some of the things available to help?
Yeah, absolutely. So like you said, you know, not all birth control is used for prevention of pregnancy. A lot of times we use it in younger women for painful periods, acne, hormonal imbalances. We use it in older women as well for some menopausal symptoms. So, you know, again, it's educating the patient, listening to the mom of the patient, you know, what the concerns are, and then just having that transparent conversation of, you know, this is what we're going to use it for, and this is how you're going to use it. And usually that tends to, you know, alleviate any concerns. I think parents will come in and they get a little nervous having that conversation. And my kids are younger, but I can identify that would be a hard conversation to have as a parent. So really giving them the information of why we're doing this, what this is going to do in their body, so they can understand it, you know.
Yeah, that's wonderful. And, you know, we've talked about parents, and obviously we do have concerns about our teens, daughters and sons. But, you know, there are unfortunately a lot of teens out there who are from homes where their parents aren't able to be very active. You know, maybe the parents have multiple jobs. What would we say to that teen? You know, can that teen still make an appointment and come in on his or her own?
Yeah, they can still come in, and we actually have a privacy.
Yes, with the Title X program, we do have that protection or that ability to see teens without a parent being available, you know, to them. You know, we do encourage them when they do come in without a parent, to have that conversation. We actually give them information on how to start that conversation with their parent. We really try to encourage them to involve their parent in their reproductive health decisions. But again, under that Title X federal grant that we have, we can see teens without a parent being present at at the time of the appointment.
Yeah. I mean, that's good to know. I know some people who have parents that work all the time and wouldn't be able to get to the health department, but maybe want their child to have that care, and so they can
or
access
unfortunately,
that.
some teens that are out there and their parents aren't involved for whatever reason or unable to be involved for whatever reason, they still have an avenue to come and get some assistance.
Absolutely. Gives them a little bit of autonomy in their own health too. So that's nice.
Okay. Yeah. And now, we've talked about birth control. What are some of the birth control options that we do have available and that we can provide at the health department? So
we offer birth control pills. We have those in stock that we can give to people on the sliding scale if we can't send it to their pharmacy. But then also, I'm certified to do Nexplanon insertion. Nexplanon insertion.
I was going to say, and what is that exactly?
So it's a form of birth control it's the bar that goes in the arm. So that's nice for some ladies who get the depot shot and they feel that they're doing well on the depot. We can advance them to the Nexplanon. So it's a little bit of a longer, it is a longer time frame. It lasts for 3 years versus 3 months. So that's kind of nice.
Okay.
And then recently I was trained in IUD insertion. So now we offer that as well.
Okay. And so you have a lot of options. And it sounds like just from what you said earlier, you probably take the time to really explain
we
those
talk
options.
through all the options and really figure out, their lifestyle is going to also determine which one we go with. So there's a lot of different, variables that play into that.
Okay. All right.
Yeah, like the individual that won't remember to take a pill every day or, have to come in every 3 months for the injection. They do have some options, to help them make those decisions, which is really nice.
Yeah, that sounds good. What about, the people out there who think, I only need to go to the doctor if I have a problem? Why is it so important? We're talking about the new year and, just making sure you're getting well and getting those appointments in the first part of the year. What would your advice be? Why do you feel like getting regular reproductive care in particular and wellness in general care, why is that so important? Why should a woman or man make that a priority, especially younger adults and teens who tend to say, I only go to the doctor if I get sick,
Yeah, that's so common. Even older people come in and they're like, I haven't been to a doctor in 20 years. And you're like, whoa.
Wow.
But a big part of it is the preventative portion, the mammograms, the PAPs, the colonoscopies, the blood work, all those things. We can catch things way before it becomes a bigger issue, like Amy was saying. So that, and also just, of course, when they come in for an annual exam, it's not just the pelvic. I'm doing a full head to toe. I'm listening to lungs. I'm doing every part of the physical assessment. So if I do come across something that I'm like, that's not normal, we look into it.
Yeah. So like if their blood pressure is high that day, you can say, hey, we need to look at this.
There's a reason that you should go to preventative appointments. You catch things that perhaps you wouldn't catch until they're a bigger problem.
Yeah. And things they were able to catch now that they couldn't catch early, even 5-10 years ago, has just, exponentially has gotten better.
Yeah.
So, and there's so many more treatment options and things like that, especially if it's caught early.
Yeah.
That they may not have that, availability to even have an option if it's later into the whatever it is that's going on with them. So.
We know that certain things, I think the average person knows that catching blood pressure problems early is a good thing, so you can get care for that. Or catching high cholesterol early is important. Catching breast cancer early is important. But what are some things specific to reproductive system in women that are important to catch early? I'm thinking of things like endometriosis, and I think it's polycystic ovarian syndrome, some of these things that later in life might make it harder for a woman to have a baby if they want to have a child. Are those things also important to kind of catch early to?
Yeah, and some of those things, endometriosis, PCOS, you pick up on just from a conversation, collecting that history and understanding if periods were irregular, certain things, kind of flag you, and then that helps me as a provider to say, okay, we need some blood work on top of this, or we need an ultrasound, or we need whatever. And so, there are some benefits for sure to being able to do that. And also I think like childbearing or going into childbearing age, we have a handful of women, honestly, that we've diagnosed with endometriosis in the last year and a half. They didn't know they had it, but they were unable to, get pregnant. So we were able to have that conversation, get them referred to the correct provider, and, they can go on to hopefully get pregnant.
Yeah. Now they have that chance. Those are some of the kinds of things we can find early, and there's really hope for, care and a cure.
Even sexually transmitted infections and diseases, caught early, because some of those are silent, so to speak, and you don't know you have it until you get checked. And some of those, if they go untreated after a period of time, or if it reinfects over and over again,
it can affect their ability to
or pelvic inflammatory disease and other things, and in men, epididymitis and things like that, can really cause some long-term,
correct
outcomes that they don't necessarily needed to have.
Yeah.
Yeah, and I know, we like to think that there aren't sexually transmitted infections in our area, but it does happen.
Chlamydia is the number one, well, other than COVID the past 2 years, chlamydia, since I've been in this position, has been the number one communicable disease transmitted in Tuscarawas County, followed by gonorrhea. So it's definitely in our county. It's definitely something that we've been trying to address, through education. Yeah, go ahead, Allie. Yeah.
Well, I was just going to say, no, absolutely. What Amy's saying. When I took this position, I was actually astonished.
That's a lot.
I was like, whoa. So it is. I mean, it's in our county. It's something that young women and men, I think, they don't think about the repercussions and they don't get the testing done. And like Amy said, it can linger for a long time without any symptoms before, it's caught.
And those are both infections that, again, if treated early, they're very treatable. And then
absolutely.
It prevents further potential complications if we get treated, for something like that. Then
absolutely.
Yes. Okay.
And then just doing a lot of education on the need for letting the partners and also knowing come in and get tested and treated. Because if not, it's just going to keep
spreading.
Yeah.
Well, when we talk about STIs, and, it's a little bit of an awkward thing, but I think it's important to say, too, someone might be embarrassed, right? Yeah. And I think one of the beautiful things about the Tuscarawas County Health Department is we provide care for everyone. There's no judgment. There's not a perfect person out there. And so, we really want to provide that care. It's about meeting that person where they are and treating them and helping them. And we're not judgmental, right? Yeah.
Absolutely not. Everybody has something.
Oh, yeah.
And I know it's embarrassing for some. I know it's hard to talk about or bring up, but it is very important because, the long-term effects of this, and you might not think about it when you're younger, but boy, when you get a little bit older and, you're trying to get pregnant or something with the man down the road, it's eventually going to catch up with you, and then you're going to wish you would have.
Yeah. So when in doubt, get care, make that one of your resolutions to come, get that care, even though you may not have visible or you might not be experiencing symptoms. It's good to just be checked out. Better to be safe than sorry.
Yeah, absolutely.
Everything.
Absolutely.
Okay. Very good. We're talking about being inclusive and taking care of all kinds of people, a question I get a lot is, can you help the people in our area that are maybe Spanish speaking? So, do we have that capability of helping those?
Absolutely. We also, employ 2 full-time translators, interpreters with our staff. We do also have the ability, I use my phone a lot. I have you do too, the Translate app.
Translate app.
And that's really good. We have the One Latino group that we've worked with in the past for certain outreach events. So we very much like working with that.
I was going to say, we see everyone. For sure.
Great. I love hearing that. We're really... at the Tuscarawas County Health Department, we're there.
We've also translated information into Spanish. We've done CQI projects on how to best educate, and we have the pictures that we use and kind of look at, how do certain populations best learn. And, unfortunately, some of our Hispanics that come, they don't read English. They don't read for some, and their dialects are different.
Yes.
So trying to find a way to be able to communicate on all of that level.
Pictures are wonderful. Videos, I'll pull my phone out sometimes, especially Nexplanon, if I'm going to be putting one in a Spanish speaking patient and you tell them I'm going to put a bar in your arm, they don't quite comprehend what you're saying, So pictures, videos are really nice tools that we use as well with the translators just to help.
And when you talk about pictures and videos, that's really kind of helpful with anyone, no matter what language they speak, I imagine.
Definitely.
We've used the pictures with the teens and things like that we've come up with. And
I think I'm a visual learner, so for me, it makes sense to show someone what I'm talking about.
Yeah, for sure. Well, and then I kind of went back to teens. Something you hear a lot about is the HPV, vaccine, and that hasn't been out as long as some other vaccines. Was that something you would recommend, as a nurse practitioner, Allie, that people get? And what would be the age what would be the age levels that someone should consider getting that?
Sure. So CDC recommends starting at 9 to 14, and that would be a 2-dose series. I guess I should back up. Do I support this? Absolutely.
Okay.
I think
what does it do?
This prevents cervical cancer, and some studies are showing it's preventing other types of cancers, other type of reproductive cancers. So for me, as a parent, as a provider, I'm looking at this saying, This is a no-brainer, at least for me. My children, when they're old enough, will definitely be getting this vaccine. I think it's smart. Seeing how, adolescents behave with one another, and in general, people behave with one another, I think it's smart to protect yourself as much as possible. And this is obviously a great vaccine.
Okay.
And then after the age of 14. So if, let's say you're late to the party, so to speak, you can still get that vaccine. Is it up to age 36?
Yeah, and they're actually looking at extending that. So
that was right
they've even seen the benefit.
They were
right.
talking about that.
Right. So they're looking at the benefits even beyond that for individuals. So, I think a lot of hesitancy on parents is, my teenagers are going to have sex, and they link it to a sexual kind of thing and not the cancer part of it. And I think, doing that education that we're trying to get out there about it, like you said, it's the cervical cancer part that is the benefit of this vaccine.
You're exactly right, though. It's when you bring up the HPV to a parent, all they hear is, my kid is sexually active. And that's not at all what I'm trying to explain, is that eventually they're probably going to be. So we need to stay ahead of that. We always need to be staying ahead of that.
Yeah.
Okay, so something you would recommend. Great.
Absolutely.
So that's something you give, I'm sure, at the Tuscarawas County Health Department?
We have it available, absolutely.
Okay, very good.
Yeah.
Okay, I'm glad I asked. And then, what about pregnant women who need vaccines? Maybe they're going to a different obstetrician, but their obstetrician says, hey, you need this vaccine or this vaccine. Is that something that we can also provide at the Tuscarawas County Health Department?
Yeah, we do offer the Tdap. They come with a prescription. We can absolutely administer that for them. This time of year, flu vaccines,
flu shots are big.
Other vaccines that, that they may need to be caught up on. We can absolutely, within the safety guidelines for the baby, we absolutely have those available.
And when we talk about vaccines, from the HPV vaccine to vaccine someone might have when they're pregnant or any other vaccine, how can people pay for those, if they come to the Tuscarawas County Health Department for a preventive vaccine?
Right. Again, through insurance.
Okay.
We do bill insurance. If they are 18 and under and on Medicaid or don't have insurance, those individuals, we have a VFC program, Vaccines for Children, so they could maybe qualify for that program as well. So we do work with them as far as, again, trying to figure out how we can help them get what they need.
So again, even if they don't have insurance that we can bill, don't let that be a barrier to getting a vaccine that your doctor thinks you should have. Is that correct?
Again, we can work with you on that.
Okay. It's really good to know. Well, ladies, I think we've covered this really well. But one question I have yet is, what are some little known fun facts about reproductive health and wellness that you wish everyone knew? Is there anything we haven't covered? Something
fun
you
facts.
wish? Well, it doesn't. Maybe not fun, but facts that wow, if I'd known that, if I'd only known that, maybe I would have had my appointment sooner. Or if I'd only known that, I would have had my child get their HPV vaccine, which I think you addressed. Is there something maybe we haven't covered?
I feel like 2020 is usually hindsight is better for some. And I think doing conversations like this is helpful to get the conversation started. Again, it's not a topic that we sit at the lunch table and talk about. You know what I mean? Yeah. It's not a topic of conversation. You talk about your blood pressure, you can talk about your appointment, but you're not going to be talking about,
pelvic exams.
Right.
Yeah, no.
Right.
Or, I need to go get my STD checked.
Yeah.
I don't know.
But it's just as important.
It is just as important. And I think breaking down that stigma is what's difficult. And I think until we're just like with other things, for a while you couldn't talk about depression. You couldn't talk about, and I think as those stigmas break down and having these frank conversations, I know when I'm out doing, things, I just say, I'm going to use correct terms. I'm going to use, correct anatomical positions, things, because that's it. This is how our body is. And it's nothing to be embarrassed about. It's just something, it's like one to the dentist. You still need to take care of these things.
Yep.
Yeah. So, anything you can think of?
Really just kind of going back to even just once a year, if you make that appointment, just once a year is enough for whatever provider you're going to pick up on anything that could be potentially an issue down the road or is an issue currently that you're just not aware of. So for me, it's all about prevention. So if they can get in there, that's going to give me the opportunity to at least look and make sure that I feel everything looks good.
All right. So use that new year as a reminder to get your wellness appointments made. Come
Lord
in
knows
and see
2020
us.
and 2021 were a hot mess, right? So let's take care of ourselves in 2022.
That's right. That's right. I think that sounds like great advice. And
it's still very important.
Yeah. And to do that, how would someone, make an appointment for the reproductive health and wellness program at the Tuscarawas County Health Department?
Yeah, sure. So they can call into the health department at 330-343-5555. And it's extension 174 or 178. That's our scheduling department. Just let them know what you're wanting to come in for. We'll help you get, the next available appointment that we have. Okay. So we're hoping to expand those hours, back up again. COVID's kind of like crunched us down. Yeah. But, we will do our best to work you in. And, we don't turn anybody away because of their inability to pay.
That's so good to know. All right. So is there anything else we need to really cover about reproductive health and wellness today, ladies?
I don't think so. I think that's...
Yeah, I don't think so either. I think it's, very important that you take care of yourself. And this is one thing you can do for yourself.
Yep.
Yeah. All right. Yeah. I agree. Well, thank you very much, Amy Kaser, Director of Nursing, and Allie Miller, a Nurse Practitioner with the Tuscarawas County Health Department. So thankful to have you here. And viewers and listeners, please take time in 2022 and every year to prioritize you and your health. Make that appointment for your annual reproductive health and wellness visit. Really take care of yourself, because when you take care of you, then you are in better shape to help all the loved ones around you. Thank you so much. This is Jennifer with the Tuscarawas County Health Department.